Over 10,000 people come through the doors of this Ottawa family practice, and the care they receive has been greatly enhanced by the power of the clinic's advanced medical record. That's because it's not only a complete record of a patient's medical history, it also alerts care teams when patients need follow-ups, tests, and procedures. It also generates reminder letters to contact patients about everything from missed physicals to pap smears. And for patients like Diane Snowball, who is recovering from breast cancer, that kind of follow-up has been reassuring during difficult times.
Oh, it's wonderful because during one of my chemo treatments, you can't forget other tests. And for my pap smear, they actually called me. It's nice that you trust them enough, if I forget something, well then you'll be followed up and taken care of. That's what you go to your doctor for.
So we just are much more reliable in doing things when we're seeing 150 patients a week, looking after 1,200 people, and trying to stay on top of all the many things that we should be doing for them and can do for them. The electronic record system helps us with that.
Your immunization record is right there. All your lab reports are right there. It actually makes it far more efficient. If they have hypertension, reminders will come up that it's time to recheck their blood work. All those reminders are listed there for us to action every time the patient comes in.
And we also have reminders that can be customized for patients. The system can also remind us and say, you know what, your family history of colonoscopy, we haven't done that colonoscopy in the last 5 years, it's time to do it again.
And it's an invaluable tool for the team in managing patients like George Roper, who suffers from complex chronic diseases. The EMR allows the team to track his drugs and dosages easily, helping them prevent potential adverse drug reactions or medication errors.
And it's easy to lose track of medication. And each time when they check out, are you taking your aspirin? Are you doing this? Are you doing that?
You still take an aspirin, the 325 milligram every day?
I do. It's very reassuring for them and for me to know that I'm doing the right things.
In a world where patients want to be more involved in their care, the EMR allows Dr. Dermer and his patients to visually follow the course of their progress together.
And so with the EMR, we can, at a single click, create a graph that shows us what our trend line is, whether we're reaching our targets. It looks like the number that we most rely on in terms of deciding where we are is still showing very well, so that trend is good.
And I can see all the trends and what's happening. And then I can get a printout of the results. And if I want to go any place, the doctor will give me a printout of my status and I can take it with me. Thank you, doctor.
I wouldn't go back to a family practice without an electronic health record, quite honestly. And everything being all together in that one chart, the duplication that will be decreased will be enormous. I think it can only lead to better things in healthcare, quite honestly.
It's a no-brainer. That's what we should be doing.
It's reassuring, generates confidence. You know what's going on.
Well, I think the only missing piece is that we're an island, and the island between us and the rest of the islands in the healthcare system are very small, very slow ferry boats. We need to be looking to have a truly comprehensive system that is in the interest of the best quality care and experience for patients in this country.